The coronavirus pandemic and its impact on the economy has left some Houstonians facing insecurity when it comes to housing, jobs, and even keeping food on the table.
And there is research giving us a clear picture as to where this is happening. Channel 2's Rochelle Turner talked with a group working to improve the lives of these families. She's live for us now in Southwest Houston with more tonight. Rochelle.
Yeah, good afternoon. Gulfton is one of the most diverse cities in Houston, and this community is home to countless immigrants and refugees who are trying to survive during this pandemic and provide a better life for their kids. The organization CHAT is helping out, but they say there's only so much they can do. If you take a step inside the CHAT organization in Southwest Houston, this is what you will see.
CHAT stands for Culture of Health Advancing Together, and the mission of our organization is to improve the health and well-being of immigrants and refugees.
That's Dr. Aisha Siddiqui. She found her purpose for helping others during her dissertation.
I was working with the South Asian women and the challenges that they face in raising the families in Houston and in the United States. That was the reason that I created this nonprofit organization. 1, 2, 3, 4, 5, 6.
This painting illustrates about 30 different aspects on how CHAT helps the community, focusing on the social determinants of health.
We do the cooking classes, or sometimes women will come and we have lunches.
The organization is nestled at this apartment complex in Gulfton, an area that Dr. Siddiqui says is mostly immigrants and refugees.
But now it's people from Middle East, people from Afghanistan, people from Southeast Asia, South Asia.
But the area faces numerous barriers on the road to good health.
During COVID, this was the most impacted area. This was the highest number of COVID cases were in this area.
The Texas Health Institute and Memorial Hermann surveyed 1,000 people in the area looking into health care crisis families are facing.
And we've known that there are particular areas of Houston where people aren't as healthy. They are more economically disadvantaged than those who live in other parts of the city, and the two are tied together.
Dr. David Callender is the president and CEO of Memorial Hermann. He says it's part of their mission to improve the health of communities.
This is a good first step for us in understanding the perspectives, and then we have some ideas about where we go with this information in the future.
The survey says people had more cases of high blood pressure, diabetes, and depression. In addition, 47% of adults in the surveyed areas do not have health insurance. Most people in the Gulfton area walk. Some must walk over 30 minutes to the nearest grocery store. Besides this halal food store and a few other mom-and-pop shops, there's not much to offer for families. But murals like this help preserve the neighborhood. It's part of the Gulf Trust Story Trail, and each mural has its own story.
They see themselves.
Dr. Siddiqui says there could be big improvements to the area and people's health if elected officials stepped up.
You know, action items like how we can improve this area and how we can make life better in this area.
And Memorial Hermann adds that there is still a lot of work to be done. Dr. Callender says they have to listen and build trust in this community in order to have a stronger Houston. We're live in Southwest Houston tonight. I'm Rochelle Turner, KPRC Channel 2 News.